back pain,
the
and for some,
glasses?
it is chronic pain. Surgery to relieve the pain is usually considered a last option. Now, new, less invasive procedures are offering promise for patients with certain types of back pain. The University of Colorado is one of a handful of centers across the United States involved in a clinical trial looking at one of these procedures. Whether you have it or hope to treat it, you know it's awful.
It kind of takes over. You know, you live by how much pain you're in that particular day.
It affects your mood. It affects your personality. It changes how grumpy you are on a day-to-day basis, and that over time becomes chronically debilitating.
All right.
Erin was in that place. Not anymore. Her back pain used to limit her life as a mom, as a wife, and an employee. Here is the quick backstory to her backstory.
I had all kinds of different tests done. I've done chiropractor, I've done acupuncture, I've done massage, I've done Pilates, I've done multiple kinds of injections, and nothing seemed to help.
Most typically it's in the buttocks area. It starts a little bit on the side of the spine and then goes down the back of the leg through the buttocks area.
Very common and yet often misdiagnosed. What is blamed on the spine or the hip may very well be the SI joint.
The joint between the sacrum and the iliac bone is the sacroiliac joint, or the SI joint. That joint really doesn't move or isn't supposed to move in most adults.
Injections into the SI joint can properly diagnose the pain. SI fusion is an option, a surgery that has evolved over the years.
We had to make big incisions and large exposures to get down to the joint. And it would be a very morbid procedure to clean out the joint, to try to put plates and screws across the joint, put bone graft in there, try to get it to fuse. With this newer procedure, we take these metal implants, which are specially designed with a porous coating, and we use our navigation system to minimally invasively put them across the SI joint and stabilize the joint.
Dr. Patel has been doing the fusion surgery for a few years now. Initially, he was a reluctant believer.
And I was pleasantly surprised. I was impressed with how much benefit we were able to get them.
Very super careful because they're tiny.
Erin had the surgery 6 months ago. 6 weeks later, the crutches were gone and Erin was back to her life, no longer letting her back control her life.
They're so used to me having to say I can't do something because my back hurts. So it's nice to not have to worry about having back pain, to just say, yeah, you know, I can do it.
Dr. Patel says it is critical that you get the proper diagnosis before you consider any surgical procedure. The clinical trial at CU will compare the SI fusion to physical therapy, injections, other manipulations, and see what is the most benefit for people with this type of pain. Also, we have something is really cool on our website right now to help anyone with back pain. 9 tips to avoid back pain and 9 myths about back pain. Both lists are really helpful, and they're worth sharing with a friend, somebody that might have back pain, and many of us know someone in that position.